Okay, I'll assume that that's sort of visible to you. Yeah, cool. Okay, so yeah, so I'm Jim. I'm a research associate on the project COVID Realities, and that's what I'm going to talk to you about today. So I'm going to give quite a general overview of the project, which is still ongoing, and kind of talk a bit about the kind of key themes specifically related to economic well-being. Here we go. So first, a bit about the project. So what is the COVID Realities project? So it's an 18-month research project that's been running since roughly June 2020 and continues until December of this year. It's funded by the Nuffield Foundation in their rapid response to COVID, and we're partnered with CPAG, Child Poverty Action Group. And there are a number of different strands to the project, and it's worth briefly sort of mentioning those. So firstly, there's a strand which is aiming to kind of create forums for researchers of poverty to explore how they will adjust their research to work in this new context. So in that strand, we've run a number of workshops looking at questions like ethics and methods, etc. The second kind of strand is a synthesis of research evidence from a number of projects, ongoing projects across the UK, looking at poverty and different kind of foci on poverty that were already up and running when the pandemic arrived. So that aspect of the project brings that together. And then finally, the kind of third aspect of the project is participatory work with parents and carers who are living on a low income during the pandemic. So both parents and carers, families who were already on a low income, but also people whose income might have dropped as a consequence of the pandemic. So this is the strand of the project that this presentation will focus on. So just a bit more about how that part works. So we worked with a web designer to produce a kind of bespoke online platform that people can log into. And we use that platform to ask questions of people. So we kind of video record questions, members of the team or invited speakers from different organizations might ask people questions and they're invited to respond. But it's also an online diary platform. So people can keep a diary on there and they have choice about whether it's published on the website or whether it isn't. So some entries can be private and some can be more kind of public. And this is forming a kind of ongoing archive. So this is accessible to kind of anyone. If you go on the website, you can search through the diary entries that have been made public. We have monthly online discussion groups. So these are called big ideas groups. And we get kind of regular numbers of about 30 coming to those groups. And I should probably say, so with the diaries, we've got like more than 2,000 entries right now. And there have been about 100 people who regularly contributed a diary entry. So in addition to the diaries and the workshops, we have other kind of workshops and events. So we've run things like media training, we've had a zine workshop, we've produced a zine. COVID Realities in Conversation is working with a sound artist to produce kind of clips, people talking about their experiences. And at the moment, we're running a series of writing workshops where participants are going to contribute to the book that we're working on. So that's kind of how the participatory kind of strand of the project has unfolded. So I'm going to move on now to talk about some of the key themes that have emerged from that work. So So these are quite a high level overview, but if you're interested in any of these in particular, there are a number of briefing notes and publications that we produced throughout the project, which are there available on the website. But the three kind of key themes that I'm going to focus on kind of really emerge out of the conversations we've had with our participants and from the diary entries. But I should kind of say the analysis of that is ongoing, and so is some of the participatory work. So the diaries have closed, but the workshops that we run are still ongoing. And in those workshops, participants themselves are identifying kind of key themes from our work together to take forward in terms of recommendations. So I'll begin by kind of talking a bit about some of the key themes that the researchers have identified, but then at the end, I'll kind of just highlight some of the concerns that our participants particularly want to talk about. So the three key themes are getting by in difficult times, manufactured uncertainty, and systematic failures. And I guess the overall kind of finding to come out is that COVID-19 has brought some new specific problems, but it's further exposed the inadequacies and weaknesses of existing systems of support for low-income families. So getting by in extraordinary times. So one of the themes that participants have told us about in diaries and in workshops are the difficulties they've faced in just getting by, in making ends meet in these extraordinary times. So in particular, people have described in detail how their normal budgeting practices have often been disrupted or just made impossible by the pandemic. Just more limited options with online shopping, the charity shops and other low-cost sort of shopping options have been closed or unavailable. There have been a shortage of particular budget items with only the more expensive items available, but also people's support networks have been significantly disrupted, which has made it much more difficult for them to kind of plan and engage in their usual budgeting practices. So this is Talia, a low mum of 3. So she told us that before COVID, I would see my brother every few months and he would give us hand-me-down clothes. A few mums would do the same. Because of COVID, I've not received any hand-me-down clothes for my sons this whole year. In September, I had to buy 3 children all brand new uniforms. I'm £2,000 in debt. I ran out of money a week last Thursday. I ran out of food over the last weekend. I've only eaten a diet based on bread and potatoes this month, as I wanted to ensure my kids had food. I was becoming nutrient deficient. So one of the things that people tell us is that because of disrupted budgeting practices and their disrupted support networks, problems and shocks become really magnified. So difficulties that they would have faced, like routine difficulties, like the big expense of school uniforms, really, has an even bigger impact on them. So moving on to the second key theme. This is the theme of manufactured uncertainties. So it's not just the difficulty of getting by that people have been keen to talk to us about, but the uncertainties they faced that have been introduced by the pandemic response itself. So in some ways, this is true for everyone, but this has been a particularly acute problem for low-income families. So to give an example that's currently in the news, the £20 increase or the forthcoming £20 cut to universal credit, has introduced significant uncertainty into people's lives. In different ways for different families, but it's had a big impact on on their well-being and on their kind of mental health, worrying about what they're going to do when it goes. And the same has been true for the job retention scheme or furlough, the minimum income floor for self-employed universal credit claimants. So significant uncertainty about how that's going to play out has just made that the usual uncertainties kind of magnified, really. But in addition to this, we can talk about isolation requirements and care arrangements of lockdowns, and the ongoing uncertainties and insecurities introduced by policy measures like conditionality, deductions from universal credit. So this is Charlotte. So she's got 2 children, and she told us that she's worried about the £20 uplift and that it will stop because she relies on it so much. I have so many new expenses since my daughter started secondary school. I don't think the government who make all these decisions about whether or not to keep the £20 uplift going has considered what we actually need it for. It's a real struggle financially at the minute. So another kind of feature of this theme is that people talk to us a great deal about the kind of distance that they perceive between themselves and decision makers and policy makers. It really seems to them that the reality of their lives has just not been considered at all in any of the arrangements of the pandemic response. Yeah. And so finally, the third theme that participants talk to us about are the ongoing structural and systemic problems they face. So I guess participants still, they're talking to us throughout the pandemic about the ongoing problems of living on a low income, which preceded the pandemic and which have not gone away. So the legacy of a decade of austerity and welfare reform, so called. So in this, people have continued to be impacted and impacted again by things like the benefit cap and being on legacy benefits, so missing out on the £20 increase. But things like the 5-week wait have continued, deductions have continued, conditionality and sanctions were paused for a while and then they returned, amid even more difficult labour market conditions and more difficult conditions in terms of arranging care, etc. So these ongoing problems have continued and they've not gone away. So this is Aurora T. Aurora was a widowed mum. She is a widowed mum of 2. And she told us she's capped on universal credit. I'm a widowed parent of 2 primary age children. Our rent alone is 95% of our total benefits. I've not been able to find work which fits around the children's school times. On top of it all, this month, the government have taken money to pay for previous benefit overpayments made when my late husband was dying. Our situation is precarious. We struggle enormously and have done for many reasons. I feel like an utter failure. So yeah, Aurora, and like we talk about this a lot in the Big Ideas meetings, Aurora's talking there about measures which preceded the pandemic, but which the pandemic response has in some ways, made even more difficult to deal with. Here we can also talk about gaps in provision, particularly free school meal provision, people who just fall outside of that, so that the kind of fragmented and patchy nature of support that exists. So those are the kind of key themes, and there are some papers and briefing notes on the website that go into each of those in a bit more depth. But the ongoing work that we're engaged in with our participants in the Big Ideas group is to come up with some policy proposals and recommendations based on their experiences. So working together with the Big Ideas group, they came up with a collective vision and a series of key principles on which they think a social security system should be based. And as I'm running out of time, I'll move on from this slide and just introduce the 3 kind of key areas that they're focusing on. So in discussion with the participants, it emerged that the kind of 3 priority areas for them, so these are by no means exclusive, but the kind of areas that they want to work on in the immediate term are improving treatment of claimants by the DWP. And by that, they mean kind of interpersonal interactions with staff, but also how they're kind of framed by policy and how they're assumed, how they're, I guess, what it's assumed their problems are, but also the processes. So bureaucratic processes, and the difficulty of redress and accountability in that system. So the second key theme or key area that they want to work on is specifically improving support for families and families with children. And then the third area, which I'm just going to kind of unpack a bit more, because I think this, for us as researchers, this has been the key kind of point that we're taking away, is they want to work on increasing the input of lived experience and their expertise into the policy process. And I guess the thing that we as a team are kind of coming to a conclusion is that this needs to happen more broadly, like across research, policy and practice. And it calls for imaginative and creative ways of involving people and bringing their knowledge and their expertise into the process and into organizations at all different levels and in different places. So it needs to be, it needs to be something that as an anti-poverty sector that we think about. And that in sort of trying to do this, we've found tremendous enthusiasm and engagement from people, across a range of different bits of the program. And I think like everyone stands to benefit from greater engagement. So the capacity building and the solidarity and the support that participants have found, but they've also found ways to kind of engage and exercise their own agency. But policy also stands to gain, as do our organisations. So I guess that's the kind of area that we're trying to work on as a research team at the moment. So yeah, thank you very much. There's a link to the website at the bottom if you want to have a look at some of those diary entries or briefing notes, and I'll end it there.